I knew about osteoporosis being in my family, but honestly, I kind of thought it was an old lady disease, and I don't see myself as an old lady. My name's Michelle. I'm 57 years old. I was diagnosed with osteoporosis in 2020. When I was diagnosed, it's kind of an interesting story. I was on vacation with my girlfriends. We were on a trip in Aruba. We were doing a little photo shoot. I just happened to bump my toe. It was a simple tap, and it broke my toe. And then I went on a few months after that, and I was at a concert with some friends. I wanted to go up and get some drinks for everybody. So I'm walking through the grass, didn't realize that there was an object in my way, and I fell in the grass onto my hands, went to the doctor's the very next day and learned that I broke my arm. And I honestly looked at the doctor and said, "No, I did not. How could I have broken my arm that way?" That's when we started to have that truthful conversation about my family history.
My name is Helen, and I'm 80 years old, and this is my daughter, Michelle. I was diagnosed with osteoporosis in 2019. My mother had osteoporosis, and two of my sisters had osteoporosis. When I saw my mom with it, she was very bent over. She had a lot of pain from it. I found out that my sister had it when she fell and broke a hip.
My aunts lost inches, and they were my idol because they were 5'9" and 5'10", and all I wanted to be was tall. But they shrunk down to 5'5", 5'6", 5'3". They lost inches. Once I realized that I had the osteoporosis, I wondered what I might have to do within my lifestyle to make adjustments so that I don't put myself at risk any further. And honestly, I didn't want to make any adjustments. And I wanted to come up with a medication that was going to help build my bones, not just stop a progression of whatever was going on with the osteoporosis, but something that was going to help build it and maybe improve it. When I went and did my research and thought EVENITY was the right option for me, I went back to my doctor and she agreed. Treatment wasn't that invasive into my lifestyle. What I like about EVENITY is that it actually can help build your bones, reduce the risk of fractures. We laid out the plan. We're going to take it once a month for 12 months. Then we would go back and evaluate and see the progression and how my bone scans were. We added calcium into my diet. We also reviewed a healthy eating lifestyle, also exercise, very important. I wanted to make sure that I was exercising, and that also helps to improve your strength. So when I went back after the 12 months, I was so excited to find out that yes, my bone density has gotten better, and I was now looking to see how can I maintain and keep my bone strength and my bones healthy. I'm doing everything I can to fight this. Knowledge is power, and that's why I'm sharing my story with you.
Important safety information. What is the most important information I should know about EVENITY? EVENITY can cause serious side effects, including increased risk of having a heart attack, stroke, or death from a cardiovascular, heart or blood vessel problem. Call your healthcare provider or get emergency help right away if you have any of these symptoms. Symptoms of heart attack, which may include chest pain or pressure, shortness of breath, feeling lightheaded or dizzy, or symptoms of stroke, which may include headache, numbness or weakness in face, arms, or legs, difficulty talking, changes in vision or loss of balance. Before you receive EVENITY, tell your healthcare provider if you have had a heart attack or stroke, especially if it has happened in the past year. Do not receive EVENITY if you have low blood calcium or are allergic to romosozumab or any ingredients in EVENITY. Before receiving EVENITY, tell your healthcare provider about all your medical conditions, including if you have a history of other heart or blood vessel problems, have low blood calcium, cannot take daily calcium and vitamin D, have kidney problems or are on kidney dialysis, plan to have dental surgery or teeth removed. What are the possible side effects of EVENITY? EVENITY may cause serious side effects, including serious allergic reactions have happened in people who receive EVENITY. Call your healthcare provider or go to the nearest emergency room right away if you have any symptoms of a serious allergic reaction, including rash, hives, swelling of the face, lips, mouth, tongue, or throat, which may cause difficulty in swallowing or breathing. Low calcium levels in your blood, hypocalcemia. EVENITY may lower the calcium levels in your blood. Your low blood calcium should be treated before you receive EVENITY. Call your healthcare provider if you have symptoms of low blood calcium such as spasms, twitches, or cramps in your muscles, numbness or tingling in your fingers, toes, or around your mouth. Severe jawbone problems, osteonecrosis may occur. Your healthcare provider should examine your mouth before you start EVENITY and may tell you to see your dentist. Ask your healthcare provider or dentist about good mouth care. Unusual thigh bone fractures. Symptoms of this type of fracture include new or unusual pain in your hip, groin, or thigh. The most common side effects of EVENITY include joint pain and headaches. These are not all the possible side effects of EVENITY. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Ask your doctor about EVENITY. Please visit EVENITY.com for full prescribing information, including boxed warning and medication guide.
Ask more questions, ask what options are available, but you're fighting for yourself.